Okay, now for our interview with constitutional law expert Robert Muise. You definitely see a red state versus blue state thing going on here. If you looked at a map of the country and saw which states are opening and which states are really being uber slow in opening, New York and California being the two that jump to mind, probably Michigan and Illinois you could throw in there also, four very prominent blue states compared to prominent red states like Texas and Florida that are moving much more quickly. So what is the public to make of this obvious difference in handling the crisis?
Yeah, I sadly, I think so much of this from the very beginning has been very political. And I'm here in Michigan, and our governor, even from the very beginning, she's kind of backed off a little bit because I think our handlers have probably advised her messages and getting across too well. It was all about attacking, President Trump for everything he did, or allegedly didn't do in the face of this coronavirus. I see, in those states that you mentioned, I mean, they tend to be the nanny states as well. Right, they're the ones who want to control and dictate everything that you do. Remember, Mayor Bloomberg in the city of New York wanted to decide, what size soft drink that you could use. So it's not necessarily surprising to me that those states, which have political leaders and political systems that are very much nanny states, where they want to control every aspect of your life in so many ways, that this is their tendency during a time like this. So if I had to guess before this all started out, and you were going to say, okay, which states do you think are going to be more restrictive? Which are the ones going to be more tyrannical in many ways? Which are the ones that are going to be more restrictive of your liberty? Which are the ones that are going to impose their will upon the people more than others? I would have picked the blue states over the red states, even without just knowing the nature of the politicians and the difference between being a conservative and being a progressive liberal, and how they view the role of government. And I think we're seeing that play out in this pandemic as well.
Yeah, I think the nanny state is probably the best explanation for why those states are going so slow. It's the most innocent explanation for them, because it starts getting more nefarious when you start thinking about the political side of it. I mean, there's some people speculating that they want the economy to be in the trash can come November when the elections come. To accuse them of that's pretty strong. I mean, if anybody's thinking along those lines, that's pretty disgusting, considering the absolute carnage that is being wreaked upon society, right, as a result of this. So, there's the famous Bill Maher comment where he said that, hey, I'd be willing to throw the economy in the trash to get rid of Trump. It's that important. So that's a semi-comedian saying it. Whether governors are really thinking that, you certainly hope not, but it does seem to me, though, they are heavily invested in the narrative that Trump did not handle this well from the beginning. This is a really big deal that he should have moved much more quickly on. And once you're invested in that idea of trying to make Trump look bad for being slow to respond to this, then you're invested in this thing being really big. So despite new evidence coming out all the time indicating that actually it turns out that it probably is not as big as we originally thought. The death rate turns out to be far lower. We're not having the overcrowding of the hospitals that we expected and so on. But these governors are clinging to that narrative as a way of continuing to be anti-Trump.
Right. And, when you think back, the Democrats in the House and the Senate were busy with this impeachment nonsense. Meanwhile, President Trump was closing travel from China, which was probably one of the most important decisions that was made to stop the spread initially than anything that has been done since then. And I think a lot of the problems that New York is seeing is because of the large number of travelers that came from Europe into New York City, and Trump closed down travel there. And every time he tried to make one of these bans on travel, it automatically became he's a racist, a xenophobe, and everything else, when at the end of the day, that was probably one of the more important decisions. But, the thing, these are local issues, right? I'm all for federalism in a sense that these are the states. The governors are the ones that should be most prepared, their hospitals prepared, not the federal government. Our federal government should have less power, not more power. And the states should be the ones, and they do under the Constitution, they have police powers, they have broader powers. They're the ones that should be handling this situation at the local level, not so much at the federal level. The federal level's role is to provide resources to bear, which President Trump has done so. I mean, and so much so that we're not even using them. I don't even think that the hospitals that were built in New York have even been used for this. And remember, what was the basis for the lockdown was principally to slow and forestall any run on the hospitals, right? That was the primary concern. It wasn't even so much that the virus is going to spread, lower the death rate, and so forth. It's all about, look, we don't want to overwhelm our health system. Well, from the reports that I've seen, our health system has been able to absorb it, and right now we have excess capacity for the COVID-19. And one of the problems we're seeing is the volume of people coming in for things like stroke, heart attack, and other cancer procedures and so forth. And I'm seriously concerned about what's going to be the fallout from that side of it on the medical. But I think if you look at what the hospital situation is, I think that lends itself to saying, look, we ought to be opening up a lot more than what we are doing currently. And we know who those that are most at risk, that we should take measures to protect those people, and not so much just one size fits all and lock everybody down. So,
well, the issue of the hospitals kind of segs into some of the legal arguments here, because if you're going to restrict people's liberty, you better have a good basis for doing it, and you better do it in the least restrictive way possible. So when they came out and announced these severe restrictions on liberty, meaning even healthy people are quarantined, young, healthy people are quarantined to their home and can only leave for very limited reasons, you got to have a good basis to do that. And they said that their concern was overwhelming the hospitals. And they showed us the charts that showed that if you have it peak, that's going to overwhelm. So we need to flatten the curve. They weren't necessarily saying that we're going to reduce the number of cases overall. If you look at those charts, that we hardly see those charts anymore, by the way, but those original charts just show the curve being flattened but being pushed out further. You continue to get cases for a longer period of time. Why? Because if you don't flatten the curve, you get herd immunity that much more quickly. So it was never about reducing the total number of cases. It was about not overwhelming the hospitals. Now that no hospitals have been overwhelmed, maybe in New York you could argue that they were overwhelmed. Maybe it sounds insensitive to me to say even maybe for New York, but keep in mind, the ship that Trump sent over there, never used. The Catholic Church that was closed and turned into a hospital, never used. So I'm not saying things weren't bad in New York City, but it never got so overwhelmed that they needed to use either of those. So, and I can also remember whenever the news cameras go into the hospitals trying to show how overwhelmed it is, I never saw a good picture of it overwhelmed. They talk to a doctor, and he's acting super relaxed and calm, and there's a nurse acting relaxed and calm. I mean, I never saw it as much as TV wanted to display it. So, but anyway, let's say I'll grant that New York City was overwhelmed. There's not any other place, I think, that was anywhere close to being overwhelmed. So if that was the standard, as soon as you saw that we hit the top and they're not overwhelmed, it's time to start giving us our liberties back immediately. I'm not saying give them all back immediately, but they should have started immediately. They have not. They clearly have moved the goalposts. So that seems to become now a weakness in any court case that they're in, because the original basis for denying our liberty, they no longer seem to be using that as the basis.
Yeah, when the burden always, when you're restricting, especially a fundamental liberty, which requires the government to have a compelling interest that's narrowly tailored and least restrictive way of reducing it. But anytime you're infringing on a liberty, it's not our burden to establish facts to prove our freedom. It's the government's burden to establish facts to not only prove that they have this compelling or substantial government interest, but then the measure that they took was the least restrictive means to accomplish that objective. And that's where a lot of this breaks down. We filed a lawsuit in the city of New York late last week challenging Mayor DeBlasio's latest edict that all outdoor, protest activity, fundamental First Amendment activity is banned in the city of New York. Yet he's got this open streets initiative where, groups of people can cycle and walk and do other things on these public streets that aren't constitutionally protected. But yet, if you're a protester with a sign and you're even maintaining social distancing, It's forbidden. I mean, they've essentially suspended the First Amendment in the city of New York. And when you have all these exceptions, and that's one of the things when you look at so many of these lawsuits and our lawsuits as well, one of the things we highlight typically is how irrational these decisions are. In Michigan, for example, you have this random selection of which businesses are going to be open, which ones aren't going to be open. And I saw one of the legislatures made a comment in the news to the effect that, you show up at one of the governor's press conferences and you wait for her to call your name, that your business is open, and okay, now we're magically open. It doesn't explain the decision making that's going into this. And we know that Tesla just filed a lawsuit in California, and it's really going to that point. You have different counties who are issuing different orders based on what it's just irrational how this is all being played out. Why one business and why one car factory in one county can operate successfully and safely, but then in another county it can't. Why? What was the justification for why these two counties have different rules when actually it's the governor's executive order that was issued that should trump over everything? So it's just the irrational way that all this is being handled is what I think is very upsetting to most people, and quite frankly is also the strongest position we have as a marital law challenging all these provisions, whether they restrict fundamental liberties or whether they restrict property interests or any other liberty interests that we might have.
And what about these emergency orders that are giving these governors, mayors, county officials this carte blanche to be making the decisions? I looked into it here in California, and it appears that there's no time limit to the governor's declaration of a state of emergency. You would think at some point legislature comes in and can weigh in on it. But as far as I can tell, and talking to a couple California attorneys about it, and me doing a little bit of my own research, couldn't find any limit in California. Now in Michigan, I think you guys did have a limit there. And tell us about the battle between the state legislature and the governor there, where they're trying to put checks on her.
Yeah, that's Michigan's an interesting example, and I agree with your concern about in California. Like, when do these emergency powers end? Even like in Michigan, you have a 28-day state of declaration of a state of emergency, but then can you renew that on day 27 for another 28 days? What's very interesting about Michigan, and we had this conversation the last time that we spoke, that Michigan has in place a measure for legislative oversight for the governor, as there should be, and hopefully if there's one of the after action items at the end of all this is every state legislature needs to go back and look at what their emergency orders are and whether or not they put in place provisions that there is legislative oversight. There has to be. One person, we don't have a king or a queen, one person cannot be the one that's had the sole discretion of whether it should be or should not be open.